we dealt with women. Now we're looking at business. Business can either be for women or men, but most of the presenters are going to be women in business. In July, we're going to be doing relationships, family, marriage, children, a little bit of mental health, but we're still kind of focusing on the woman from May. We dealt with women, Mother's Day, and so on and so forth. Praise God. But I'm trusting that you're all learning, and that we're not just learning, but that we're learning. And amen. Praise God. So God is good, and his mercies endureth forever. Today we're going to be talking about insurance and insurance needs, Medicare needs. And this is the Medicare benefits are particularly for the United States. We're going to have another session in which we're going to get someone from Jamaica that will talk about the different kind of benefits that is offered in that country, because we have a lot of Jamaicans on the line. But that will be next week. This week we're doing insurance, because a lot of the principles are the same, because most of the companies in the Caribbean, they're usually a subsidiary or a branch of an international company. Because I remember from way back when my insurance was Blue Cross, then it became Blue Cross Blue Shield, and the different Alico and all those plans that we have. There were companies that were from the United States, but so the benefits are going to be same in a lot of senses, but we're going to have a special teachings for the ones in Jamaica. So today we have evangelist Donna Edwards. She's an evangelist with Emmanuel Apostolic here in Miramar, and you're an IP. Sorry, excuse me. You're an IPC, so most of you are familiar with Sister Edwards. She's on it quite often, and the allergies choose the most awkward time to show up and show itself. Amen. And I think she's going to have somebody with her. So Sister Donna, if you could tell me who is the person you have so I could make them a co-host as well.
Well, Donna Scorby.
Oh, that's okay. Donna Scorby. All right. I was thinking. All right. So welcome to Donna Scorby to the Monica Jones Ministries. And I make you a co-host so both of you can go and teach. Who is that beautiful person behind you in your background?
Oh, that's me.
That's you?
Oh, that's
I thought that was your mother that looked like a throwback, like a movie star from the black and white pictures. So I'm saying, okay, who is that? Oh my word. Wow. That is a beautiful picture. Black and white picture is so beautiful. That looks real good. Anyway, that's a aside. Anyway, welcome to the two Donnas. Amen. And Donna mean lady. So we have two Donnas. We have two Madonnas.
Thank you.
Welcome here. I'm handing over to you right now and stop talking.
Thank you. Donna, do you want to kick us off? And I'll just kind of be here to support you. Oh, no, just go ahead. Okay. Well, my name, as you said, is Donna Scobie, and I am a local manager for Humana Insurance in lovely Broward County, Florida. So if you hear anything today that you have questions on, feel free to call my associate Donna, or you could call me as well, and I can put my name and phone number in the chat box.
In the chat, right.
But we're just going to talk a little bit about Medicare. It'll just take us a few minutes. I don't know if many of you are eligible for Medicare, or you might have a mom or a family member who's looking into Medicare. But today we're going to just talk a little bit about it, give you the ABCs of Medicare. So are you eligible? You have to be at least 65 years of age. Or you can be under 65 and qualify due to disability. And you have to be a citizen or a legal resident in the United States for at least 5 years. So not too many criteria there. And Medicare enrollment period. So when you turn 65, you're given an opportunity you're actually automatically placed in Part A of Medicare, and then you can participate to join Part B of Medicare, and that's called your initial enrollment period, and that occurs 3 months before the month of and 3 months after your birthday, usually when you're turning 65. And after that, once a year, once you're on Medicare, once a year, you would have an opportunity to add additional coverage to your Medicare A and B. Sometimes it's called an Advantage plan or a supplement, but you're given that opportunity to add the coverage during what we call an annual enrollment period, which is October 15th through December 7th. There are special election periods throughout the year that you may qualify for as well. So the AEP, which we call the annual enrollment period, and SEPs are really for someone who's already been on Medicare. They're enrolled in both A and B, and maybe they want to make a change to that current coverage. They can do so, but only during certain times of the year.
Okay, so what is Part A of Medicare?
Well, we're going to go into that. Part A
okay,
right here.
okay.
Covers hospital stays and inpatient care. So just think about anything that happens in the hospital would be considered Part A. And that's given to you automatically because you've worked so many quarters, so many years. And if you work a certain amount of years, you get A automatically and it's paid for. And then Part B, you can add, it's given to you automatically, but there is a premium associated with it. So you get your Social Security check, and Social Security takes out $164.90. So you could have Part B of Medicare. And Part B would help pay for everything outside of a hospital. So think about your doctor visits, your lab work, any kind of medical care that you would need outside of a hospital would be covered with Part B of Medicare. So you should have A and B because they both do different things. They both cover different things. And see the picture there of the red, white, and blue. So that shows you if you have a card and it has A and B on it, then you are fully enrolled in Medicare with both parts. And Donna, feel free to jump in at any point if you want. So once you have Medicare A and B, there are a lot of deductibles and co-insurance amounts. So you're not covered 100% with Medicare A and B. So a lot of people say, well, if I go into a hospital, what is the what am I going to have to pay? Well, with just Medicare, there's like $1,100 for this and 20% of that. And it gets to be quite a lot of out-of-pocket expense. So people will look towards supplementing their Medicare with an additional coverage. So this is where Humana does a big job in Broward County because Humana has been in Broward for 30 years helping people with Medicare. And we offer something called a Medicare Advantage plan or Part C of Medicare. So now we would work with Medicare A and B, and you would actually be enrolling into a co-payment style plan. So many of you may have had that at work when you were working, but you go to a doctor and you pay to see the doctor, and that's all you pay. So for Humana, for example, a primary care physician would be $0. A specialist is $0. Even a hospital is $0. But Medicare Part C does not include prescriptions. Well, it could, but Medicare by itself, A and B, doesn't include prescriptions. So we really encourage to make sure you have coverage that's going to pay for your prescriptions, because as you all know, those could be quite costly. So if you're looking at a Medicare Advantage plan, I would recommend you look at one that covers doctors, hospitals, and medicine all in one plan. And there's Part D of Medicare, which is a standalone prescription plan. And there's Medicare supplement plans, which is different from an Advantage plan just because it doesn't have a network. Yeah, with a Medicare supplement, you can see any doctor as long as that doctor accepts Medicare. But those plans, so you don't have a network, you don't have to worry about referrals, but they tend to be more expensive than an Advantage plan. But you have those options. And I think that's what Donna was hoping to point out today, is just that you have several different options when you're on Medicare to what you can add to Medicare to get the full coverage. Medicare Part C, which is what Humana does mostly in Broward County, is considered a Medicare Advantage plan with prescription drug coverage, which means you get all the benefits of original Medicare and a lot of extras, including the medicine coverage. We give an allowance for dental and vision and hearing. There's an allowance to buy vitamins, nutritional supplements, over-the-counter items. We provide a membership to the gym. If you like to work out and want to go to the YMCA or LA Fitness, we'll provide that. We'll pay for that. And those all come included in these Medicare Advantage plans. And then there's different types of Advantage plans. So if you said, hey, Donna, that sounds great. I like paying $0 to see my doctor. Talk to me more about that. Well, we have different types of Medicare Advantage plans. And we're just going to talk really high level now. But HMO is one style of plan, which usually has the least money out of pocket. But you have to get a referral to see a specialist. But here in Broward County, Humana has so many doctors. Usually it's not an issue getting a specialist. PPO though, if you say, hey, I travel a lot, I go see my kids in North Carolina or wherever they may be, I don't want to have to worry about referrals, I just want to go. Well, that would be more of a PPO style. So you can look at a PPO instead of an HMO. An HMO says you've got to get all your care within Broward, Dade, or Palm Beach County, where PPO says you can go anywhere in the United States for care. So depending on your lifestyle and what you're looking for, you would look at either an HMO or a PPO. And the private fee for service we really won't talk about, because that's really more if you're living in a different state and more rural area where there's not a lot of access to doctors. So, but if you lived here in South Florida, we would focus on the HMO and the PPO. And then, of course, we've got Medicare Part D. So you might say to me, well, you know what? I like my A and B. I don't want to add anything to it. I just want to keep it alone, just have A and B. But we really would recommend that you pick up a medicine plan, something to cover your prescriptions. So you could enroll in just a standalone prescription drug plan. That's called a Part D plan. And I would just make sure when you're meeting with an agent that they look up all your medications to make sure they're covered by that plan and find out what tier they fall into. And what I mean by that is on this next page, all medicines are, if they're covered, they're all grouped into a certain category. We call them tiers, but it's just different groups. So group 1 would be our preferred generics, as you can see there. Group 2 would be generic, and then a preferred brand is a name brand medication where there are generics available, but the doctor just prefers to have you on the name brands. That would be preferred. Non-preferred typically are more expensive, but those are medications that are higher, like I said, more expensive, but they don't have a generic available. So they're most of the times you see these advertised on TV. Those are the non-preferred medications. And then specialty medication is one that you have to go to a compounding pharmacy where they're going to make it up just for you. It's a special prescription where the pharmacist mixes it up and it's unique to you. That's called a specialty tier, specialty medicine. So all medicines fall into one of these categories, and based on where they fall, that's going to determine the cost that you pay. So for example, tiers 1 and 2 generics on most plans will be $0 out of your pocket. Tier 3 may be $5 all the way up to $40, depending on the plan you choose. But my advice is if you're sitting down with someone and you have them look up your medications to make sure they're covered, and then ask them, okay, well, what tier or what group are they falling into? Because that'll tell you what your out-of-pocket payment will be when you go to the pharmacy to get that medicine. It's very important. And then every formulary is different. So if you're looking at 2 different plans, have them look them up on each plan. And then there is something called a coverage gap or a donut hole in Medicare prescription drug coverage. If any of you are on Medicare now and you are on a Medicare Advantage plan or you have a prescription plan, you'll know that with a coverage gap, what that means is Medicare allows you to have a certain amount of money every year to pay towards your medications. So for example, it might be $4,300, where every time you go and you fill your prescription at the pharmacy, even though you're paying $0, that medication may cost $100. Well, that $100 is subtracted out of your checkbook of money. So now your $4,300 is down to $4,200. And as you go throughout the year, even though you're paying a smaller amount in copay, the full retail cost of the medicine is coming out of your allowable checkbook amount that Medicare gives you. But if you ever deplete your checkbook down to zero, then you're in what you're in is called the coverage gap, or the donut hole, some people call it. And that's where the insurance companies step out and they say, okay, Mr. Jones, you're on your own now. We're not going to participate and help pay for your medication. So now that $0 medication that you were enjoying paying for, zero, may now be $100. So you might say, well, that's difficult. What am I going to do? But that's called the coverage gap. So you have to make sure the agent that you're working with talks to you about how medications would be covered during this gap in coverage. And then,
All right, can I ask a question?
Yeah, sure.
Because I want to know what would be the difference in price from an HMO and a PPO? Because if I can come out of your network of doctors and choose my own doctors, wouldn't that cost me more? I'm not using your doctors?
Yeah, that's a good question. What you'll find is the copay to see that doctor may be the same or higher. So the HMO will have a $0 for primary, but where you'll, and so will the PPO, where you'll see the increase will be in a specialist visit or in the hospital visit. So yes, the PPO is nice because it gives you the freedom and flexibility to move around the community without a referral and really without a stricter network, but you're going to pay more in the plan when you go to use it. So if you have a lot of illnesses and you're going to a doctor on a regular basis and seeing a lot of different doctors, you may be better off on the HMO because you'll have a lower out-of-pocket cost. But on the PPO, you know, you would have to pay more to see those doctors and to go into a hospital. So for example, on an HMO, you may have $0 to be in the hospital. So no matter what happens in the hospital, you have 5 surgeries, 6 blood transfusions, whatever it may be, with the HMO, you walk out owing nothing. But on the PPO, they might say, well, it's $150 a day, days 1 through 7. So you would know you would pay that $150 for every day you're in there up to day 7. So you're going to pay more on the PPO because you're getting the luxury of having that freedom to move around the medical community. So that's a good question.
All right, now the question I have for you, because if you're on A and B and you have Part C, you said for the prescription, right, and then when that Part C is finished, then could you, there is no way to prevent a person like from going online and sourcing their medication online, right? Because Canadian drugs normally sell at a cheaper price.
Right.
Or that's not something that's recommended.
Yeah, if I used up all of my checkbook from Medicare and now I have to pay for it on my own, you have to get through the donut hole. There's another side of the donut hole. So the other side might be $6,500. So I fall in at $4,300 and I can get out at $6,500. So what that means is for that $1,500 or whatever it is, I'm paying that on my own, but they're still counting the money. And once I get to the other side of the donut hole and I spend the $6,300, then all my medicines are no more than $5. So if you went to Canada and got those wouldn't count towards getting out of the donut hole.
Oh, okay.
But one thing I didn't mention is that while you're in this gap of the coverage, you are getting, you're eligible, and you usually do get manufacturer's discounts applied to the cost of the medicine, but you're still going to be paying quite a bit more than while you're still not in the donut hole. But it is something that's standard for all companies. So it's not something that's unique to one company or another. And then some people think too, well, what if I have Humana and I fall in the donut hole and now I have to pay all this money from my medicines? Can I move to United Healthcare and start all over again? No, that donut hole follows you, but it starts over every year. So January to January is the year cycle. But yeah, my point is you can't go from one company to another in the middle of the year and expect to start over the clock or the checkbook. It doesn't work that way.
Wow.
So every month, for example, Humana will send out a statement to our members, and it's like, looks like a pie chart, and they'll color it in so the person will know well in advance if they're getting close to filling up their pie. That means they're going to fall into that donut hole. So they can kind of track it throughout the year and prepare for it when and if it comes. It's just something that is that's a Medicare stipulated requirement that we have to have in all of our plans.
Okay.
Good questions. Thank you. Medicare supplement plan is another style of plan that will supplement Medicare, but they tend to be very costly. They have no network, like I had said earlier. As long as the doctor is willing to accept Medicare, you can go see a doctor with a Medicare supplement. But a lot of people like the Medicare Advantage plans because they're most of the time zero premium, and Medicare supplements can be as high as $120 a month, in addition to the Part B premium that we forget everybody's paying, the $164.90. So if you have the $164 and then you have like $100 a month for this supplement plan, then they don't cover drugs. So you got to pick up a drug plan for another $30. So they can be very costly, but it is an option, and it just provides you with like the Cadillac level of coverage, where you can just go to any doctor irregardless of whether they're in the network or not in the network. And then special needs plans, and we do have a percentage of the population that may qualify for a special plan. And typically it could be someone that has a chronic condition, such as diabetes, heart disease, or chronic lung disorder. We do have Medicare Advantage plans designed for folks that have these types of conditions that have special programs built inside the plans to cater to that condition. So a diabetic plan might have special programs and opportunities that more so than another plan for non-diabetic. So those are out there as well. So if you're meeting with someone, ask them if they have any special plans for certain health conditions, and make sure they're sharing that information with you. And how do you even choose a Medicare Advantage plan? What you should be looking at, basically how much are the premiums? Well, down here in South Florida, whether it be Broward, Palm Beach, or Dade, most of the plans that you'll see are $0, so there really won't be a premium. But if you're looking at a Medicare supplement plan, that could be like $100. Coverage, you want to make sure the plan includes prescription coverage, because that is important. You want to make sure your medicines are covered. You want to make sure your doctor is covered. So if you were meeting with me and you're like, oh, Donna, I want you to help me pick the right coverage, I would say, well, are there any doctors that you would like me to look up? So make sure the agent is looking up all of your doctors, make sure they're covered under the plan, because you don't want to enroll in a plan and then go to the doctor and they say, oh no, we don't take this. So make sure they're looking up the doctors for you, as well as looking up your medications. Make sure the medications are covered. And then most of the time, submitting claim forms is not your responsibility. That would happen electronically between the provider and the insurance company. Health history, think about how often are you going to see a doctor? And like you had asked earlier, the HMO versus PPO. Well, what network is your doctor in, and how often are you seeing that doctor? And do you want to pay? Are you okay paying a little bit more for the PPO, so you don't have to worry about referrals? Like my parents have the PPO. My mom's like, I don't want to have to worry if I get cancer, I want to be able to go to whatever hospital I want and whatever doctor I want. So she went with the PPO. or I have a friend who went with the HMO. So he's like, look, I have a lot of doctors. I go to the doctor a lot. I don't want to have to be out of pocket a lot because, money is tight. So he's more comfortable with the HMO. So it just depends on your needs. So make sure whoever you're meeting with is doing a needs analysis when they're first meeting with you. They're asking you questions like, what would you like in your plan? What's important to you? Would you like me to look up doctors? Would you like me to check your medicines? So make sure they're doing all this for you, because that's the only way they're going to get to know you and know what plan to recommend to you. Make sure they're taking that time to do that with you. And helpful resources: when you're turning 65, you do get a book called a Medicare and You book. Medicare mails it out. It talks all about how Medicare A and B and what they cover. So, definitely make sure you have A and B. And I don't want you to think, oh, well, I have A and B, I don't need anything else, because you really should look at other coverage, because Medicare A has deductibles and co-insurance amounts, and Part B does too. I mean, Part B says Medicare, you would pay 20% of everything. So 20% of what? Well, 20% of what the doctor's charging. So if a doctor visit is $200 and you're going to pay 20% of that every time you go, is that more or less than what a policy would be? So you need to check that, but I would be pretty sure that having an Advantage plan is going to save you money and leave you less exposed. I remember I went to sell a woman's house, and she just had Medicare A and B, and she wanted me to talk to her about these Medicare Advantage plans. And she just gotten out of the hospital like a month or so ago, and she pulled out this shoebox, and she opened the shoebox, and inside the shoebox was a pile of bills that she had gotten from doctors, anesthesiologists, or labs. And she's like, I can't pay these. It's 20% for this, 20% for that. She's like, there's no way I can pay all these. She's like, so I don't know what I'm going to do. But had she had, an Advantage plan or a supplement plan, the insurance companies would have paid all that. So don't leave yourself exposed. If you're young and you're not 65, talk to your mom and dad, find out what they've done, find out what plans they have, get familiar with that plan, because in the time of need, when they need you, I would rather you be familiar with their plan and know what they have covered than to find out in that time of crisis. And that's all I had. I don't know, Donna, if you wanted to add anything. If anybody has any questions for me or for Donna.
Question: what if you're on Medicaid? Because for those that cannot afford, or you have Medicaid and Medicare, what if you have Medicare and Medicaid in?
Right, I love that question.
Medicaid have Part A and B as well?
Yes, I love that question, because sometimes I'll meet with folks and they'll be like, well, Donna, I have Medicare and Medicaid. Why do I need anything that you offer? Well, something that the insurance companies can offer is when somebody has Medicare and Medicaid, they have to go to a Medicaid approved provider. And sometimes those providers are a little bit far from their house. It might be 3 or 4 bus rides away, or it might be a long time before they can get an appointment. So if they enroll in a Medicare Advantage plan, like a Humana plan, for example, they can go to any doctor in the Humana network. So it opens up the network of doctors to them. They have a lot more doctors to choose from. And the Medicaid plans, everything, because we're coordinating, Humana would coordinate with Medicaid and Medicare. So in those plans, the insured is basically paying nothing for all services, because Medicaid and Humana are picking up all the costs. And then, for example, in a plan, they get money for food. Like one of our plans has $275 a month that they can use to buy food or pay a utility bill or pay for their rent. And those policies have money for over-the-counter items. And so there's a lot of incentive for someone, and there's a lot of extra benefits above what Medicaid provides. So it definitely would be worthwhile for somebody with Medicare and Medicaid to look at one of these plans also, because it provides them with additional dental, vision, hearing, food, the food money. So it's definitely worthwhile. So that's a good question. Thank you.
Amen. I have one more question for you because hold on. I was thinking of the question. Oh yes. Do you find that since COVID that more people are retiring early? And how does early retirement affect your Medicare, Medicaid, and if you need, and what level of supplemental you would need?
Well, I don't see a lot of people retiring early. I see the opposite, that people are retiring later. The only thing I would say is to watch out for is if you retire at 62, 63, you're not going to get Medicare until you're 65. So you're going to have to figure out how am I going to get my health insurance? So, going out on the exchange and getting Obamacare could be more money than maybe what they were spending when they had their employer coverage. So that is one of the downsides to retiring early.
Okay,
Is
so you still have to wait to 65.
Right, 65 is the age you're getting your Medicare A and B, and you get it automatically when you turn 65, or if you qualify through disability, it doesn't matter what age. It could be any age, but most folks are the turning 65.
And they're still working.
Yeah. I mean, we're seeing 67, 68 years old, unfortunately. I'm like, oh, I like the 60 age retiring, but I don't think that's going to happen for me.
Because I was hearing some people talking and they said, listen, ever since COVID, we have no guarantee that we're going to live to even 65 years old or whatever. So we might as well retire now and get our benefits while we can enjoy them, because we never know if there's another pandemic. Right. You just may not survive the pandemic. So you work for the benefits, you might as well get the benefit now. But you're saying even if you retire and go on Social Security, you still have to wait for 65.
Right. Yep. So,
but would you be able to buy like the supplemental Part D?
No.
You
would have to go through individual health insurance until you're 65. So you would have to sit down with somebody who does individual medical, like I was saying, Obamacare on the exchange or off the exchange, and actually buying individual health insurance, which could be $200, $300, $400 a month depending on your situation. So that is a big expense and something to consider, but then it would go away once you turn 65 and Medicare would kick in.
Okay.
Well, I've given you a lot of information.
Early. This is a disincentive.
Well, I know I've given you a lot of information today, and I've kind of run through it at a very high level. But if you have any questions, feel free to reach out to me or my partner, Donna, the two Donnas today. And I really appreciate your time and allowing me to come on and share this information with you. It's been a delight, and I appreciate it. Thank you.
Okay, you're welcome. Does anybody have any questions to ask concerning?
Yes, I have a question.
Okay, go ahead and ask your question.
Okay, so this is a personal question. My husband is retiring, and so we're not gonna. Well, he has Medicare and part of Medicare. However, I am gonna have to look for insurance. How do I navigate from having private insurance to where do I go from here?
Yeah, you'll have to, well, first I would see if the company he's retiring from has COBRA, which allows you to continue the group plan up to 36 months after he leaves. So I would check that first and see the cost of that. And if not, then I would just say meet with an agent that sells individual health insurance, and they'll be able to guide you. But you're going to have to enroll into an individual health insurance plan until you're.
That's like Obamacare?
Yes, ma'am. Yes.
Oh, okay.
Yep.
And that will be until she gets to 65, and then she will get the Medicare Part A and B?
Correct. Yes.
That's like 4 years from now.
Okay.
Yeah.
Okay, thank you.
Okay, of course.
But Donna, could we remind them about anything for veterans?
Well, we do have, veterans typically will use the VA. for their care and services. A lot of the insurance companies, such as Humana, have come out with policies that are geared towards our veterans. They're called an honors plan, where it's a medical public policy only, where they can still, most veterans get their medicines from the VA because it's so inexpensive at the VA. I think none of the medicines are more than $12. But there are several plans out there that are $0 that just gives medical insurance, not the medicine. So the thinking behind that is if you're a veteran and you don't want to have to go all the way up to the VA to get care, you can go anywhere in the network for the insurance company that you sign up with, like Humana. You could carry the Humana card in the wallet, and if you want to get a second opinion, or if you have an emergency, you can go outside the VA for your care, and then Humana would cover that. And then you could go, of course, to the VA for care, and the VA would cover that. So basically, and it's no cost, so why not carry that in the wallet in case of an emergency? You're out of the area or you're away from a VA facility, you don't have to worry because you've kept the Humana card in your wallet, and Humana will pay for anything that happens to you outside the VA.
Okay.
So what if I live in Broward and I'm moving to Tallahassee?
Okay. Let's just say if you were on one of these plans in Broward, and if you moved to Palm Beach or Dade, you could stay on the same plan, because the Tri-County area is the service area for South Florida. But if you move to Orlando or Tallahassee or another part of the state of Florida, you would actually have to enroll in a plan that services that new area that you're in.
Now is a transition. Is it, or is it, how long does it take?
You have 60 days to change plans. And, let's just say if you're young and you want your mom to come and live with you, and you live in a different part of the state or a different part of the country, your mom or you would have 60 days to make a change to the plan, to enroll into a plan in that current area. So you have 2 months.
For those who haven't reached the would have to get insurance otherwise, whether it is Obamacare or whether it is something that's not insurance, but it's a co-share or cost sharing.
Right. Yes. Or else you're just going to be exposed and be responsible for the medical bills, which of course you don't want to leave yourself exposed that way. I would highly recommend you sit down and speak to someone about, because having some exposure, even a high deductible plan, is better than having nothing. So if you were like the young lady on the phone who was 60 or 61, and she's looking at insurance, they might say, oh, well, they have a plan with co-pays like your husband has, it's $400 a month. And she might say, well, I don't want to spend that kind of money. Well, they might say, well, we have a high deductible plan that says, kind of like your car insurance, you pay the first $3,000 and then the plan will pay 50% after that. And the premium might only be $200. So you'll need to decide what direction you want to go in. So if they talk about a high deductible, just think of it as a car deductible. That's what you're going to be asked to pay before the insurance company kicks in any money. And how much are you willing to pay? How high deductible are you willing to absorb before the insurance company helps you out?
So thank you, Donna. And we just want to go over just to reiterate some of the things, the different periods that we have that's available for Medicare, the open enrollment, the special enrollment that happens whenever, it's always open. But the annual enrollment, and that is October to December. And remember that if you are turning 65, say you're turning 65 this month, you would have been able to sign up for Medicare 3 months before this month. So this is June, it will be May, April, or March. So you'll be able to start from March, and then you have 3 months after this month. So you have July, August, and September. But if your birthday is the first of the month, it starts 1 month earlier, correct, Donna? and it ends 1 month earlier too.
Right. I mean, typically somebody will have 7 months, 3 months before the month of and 3 months after when they are turning 65 to elect coverage. Mhm.
What are some of the penalties that they face if they don't do the Medicare in time, or
Right, that's a good question as well. If somebody says, well, you know, Donna, you told me Part A, I don't pay anything, but Part B costs $164.90. I don't want to pay that. I'm just gonna go with the hospital coverage, the Part A, and I'm gonna tell Medicare I don't want Part B. I'll tell Social Security not to take that money out of my check. You can do that. And if later down the road you decide to pick up Part B, then there is a late enrollment penalty. And it could be quite high depending on how long you wait to pick the coverage back up. Same thing for the prescription drug plan. You might say, oh, well, I just want the hospital coverage. I don't want the doctor coverage. I don't want the medicine coverage. Well, Medicare says, okay, fine. You were eligible for it. You chose not to take it. We're going to penalize you for that too. So there would be a penalty for Part D, not enrolling in Part D, and also not taking Part B when you're first initially eligible. And again, it just depends on how long you wait to pick up the coverage. And unfortunately, once you impose the penalties stay with you forever. They don't drop off. So instead of paying $164.90, your premium might be $204.10 forever because you decided not to take it for 3 years. You know, they're gonna hit you with the penalty, and that penalty doesn't go away. So good question.
okay. I had a client who had a different coverage. And then when she went to her doctor, she was doing implants. And the coverage that she had on that particular plan, she was kind of worried that it was high. So she was thinking of switching to another plan that would be more affordable for her. Can you shed some light on something like that?
Yeah, well, a lot of these Medicare Advantage plans include dental coverage. So what level of dental is going to be determined by the plan that you're looking at. So Humana, maybe it will be different than United Healthcare, which is different from any other, another carrier. So looking at, that's why I think it's important when we're meeting with folks and talking to them about which plan is best suited for them, we talk about what's important to them. So some plans have more generous dental benefits than others. So implants is considered really more cosmetic. So certain plans will cover those to a certain dollar amount. Some plans won't cover it at all. So it just depends on the plan. And if that person enrolls in the plan and gets some work done and doesn't get to finish it, they can't just change to another plan anytime during the year unless they have a special election, like we were saying earlier. Maybe that person moves to a different area. Somebody on Medicaid could, every 3 months, somebody on Medicaid can make a change to a different plan. But really, it's going to be determined by the plan and the coverage that the plan is providing for that particular service. And implants are one of those things that just a few carriers are covering because it is so expensive. But there are companies that are covering it, and there are some that just are not. So it just is going to depend on who you're talking to. They'll recommend the appropriate plan.
Yeah, we just want to shed some light to remind folks that in order to qualify, there has to be a 40 pay.
Well, it's really not a matter of qualifying. I mean, if they're enrolled on a Medicare Advantage plan, the plan will have what they call a summary of benefits. And in that benefits summary, it'll list out what's covered. And you would want to look to make sure under the dental section that implants would be covered. And if so, at what dollar amount, is there a certain dollar amount? Is it a certain percentage of it? So it should all be listed in the actual policy. And anybody you meet with should be able to present that information to you. And if they don't, then I would say don't do business with them because they're hiding something.
I have a question. I was trying to ask my question and wondered not why nobody was answering me. I was on mute. Someone on Facebook is asking, if you get Medicare, they came on afterward. If you get Medicare, do you need a medical supplemental plan?
Well, I would recommend that. Yes, I would. It's not mandatory, but it's suggested because Medicare A and B has co-insurance amounts, deductibles, and they could be quite costly. So you may not want to leave yourself financially exposed to those deductibles and co-insurance amounts. So if you enroll in an Advantage plan or a supplement plan, those plans will pay those deductibles and co-insurance. So now, for example, with an Advantage plan, you pay a copay. So you'll always know what your out-of-pocket expense will be before you even need it. So if I told you it's zero for the hospital, you'll know it's zero for the hospital for the plan. But with Medicare, they'll say, well, you've got to pay the first, I don't know the exact numbers, but $1,100. And then after that, you have to pay 20% of this doctor and 20%. Well, and then you're like, well, 20% of what? And 20% who is this? Well, the anesthesiologist will send you a bill, and the doctors, and all the doctors that come into the hospital and check on you and write their name on the chart. Like we call them howdy doctors. They come in, they say howdy, they sign your chart, and they send you a bill. So leaving yourself financially exposed to all of that is scary. So that's why so many folks are looking at these Advantage plans, because they know what their financial exposure will be if and when they need the care.
So basically is if your Medicare will cover, like say 70 or 80% of your hospital bill, then you will get a supplemental plan for 30% so that you will have 100% coverage, so that you will have no out-of-pocket expense. So the supplemental, because hospital bills are very, very high.
Right.
You're trying to cover all the base so that in the event of an emergency or a surgery or a procedure, you don't want to be owing and then have to go on a plan to pay monthly. So on.
And if I'm telling you, you can sign up for a plan that'll pay that 30% or whatever it may be and not cost you anything. These plans are zero premium. It just makes financial sense for you to do that. It's not, just to protect yourself.
All right, I have another question. What about the prescription medication? I know most insurance policies have an OTC and they give you a set amount and they have their catalog and you can get some things for free.
Yes.
But what about those psychotic drugs, those drugs that cost like the $300 and so dollars, those very expensive drugs that some people have to buy? They are so expensive, and it is per pill, not even for a set, it's per pill. And when you have to pay that, even with a copay, it is still a lot of money per pill. So what can be done, like really say from even the insurance point of view now, to get the medication, especially those medication, to a manageable level where people don't have to choose? Because I know some people who take their pills every other day, or they're in so much pain and they're going to run out of the pill before the end, so they skip and they will take something like a Tylenol PM in between, and then they take the pill every other day and use that in between to bridge the pain, because they're going to run out before the month end and they're on a specific amount of pills and they cannot afford to buy pills because they're so expensive.
Well, that's why if I would suggest that a family member and that person or that person's when they're sitting down with an agent, they give that information, the prescription list, to the person that's helping them, and make sure that they're looking up the medicine, because many of these plans that we've talked about today include prescription coverage. But you want to make sure that your particular prescriptions are covered under the plan. And if they are, then for a 30-day supply, there's a set copay. And as long as the doctor continues to write the prescription, the insurance companies will cover that medicine. The only time you'll run into an issue is if they fall into that hole, that donut hole or coverage gap, where the cost of the medicine would go up. But some plans, if they could get a generic psychological or medicine, generics are oftentimes covered all through the year without the donut hole. So it's going to depend on the medication. A lot of those are covered. It's just going to depend on the plan you're looking at, and making sure that when you're selecting a plan, you're picking one that is going to work for you, and it's going to cover your medicines, and it's going to allow you to see the doctors that you're seeing. So, take your time and have that person look all that up to make sure that you're being enrolled into the correct plan.
Okay, here's a question from the chat. What about people who don't have insurance, any kind of health insurance at all, and they do not qualify for Medicaid? What does Humana offer?
Well, unfortunately, nothing.
You specifically work with Medicaid and Medicare.
Yeah, we, Humana is not in the market for individual health insurance. They focus on the Medicare, but I know Donna's licensed with a number of different companies, and there's different health insurance. But if they have nothing, if they're just a cash paying person, oftentimes if you go to a pharmacy, there's a price for a medicine that's a cash price, and then there's a price that's for an insurance company price. So I would just say work with the pharmacy that you're going to, and seeing if you can negotiate some type of lower cost for that, because you're self-insuring. Sometimes doctor offices will charge you less if they know you don't have insurance, then they would bill the insurance company. So it's just a conversation you'll have to have with your providers to see. But there are a lot of people out there that don't have anything. They self-insure, and that's just the way it works out, because they don't have much of a choice to do anything otherwise. But
okay, there is a question on Facebook, and I'm going to take the question on the chat. Facebook question is, would you suggest a prescription drug plan?
Well, if we're talking about somebody under 65, I would suggest a drug discount plan. There are some companies like GoodRx that I'm familiar with. My daughter actually had it because she was self-employed and she didn't have insurance, and she has a GoodRx discount card. So she'll take that card to the pharmacy. She shows that card. She doesn't have to pay for it or anything, and they give her a discount on the medication. And
that's what that was my next question, because I'm familiar with GoodRx. You don't even have to get the card. You just go with the barcode on your phone and give it to the pharmacy, and they just get it directly from off of your phone. But the question is, if you're on Medicare and say you have Part C and D, which are the prescription plan, can you still apply, get GoodRx to go with Medicare?
No.
You will not get you cannot.
Right. No, the Medicare Advantage plan would be the primary, and there would be no discounts on that.
No discount on that.
Right.
Okay.
Right. That's really going to be for somebody under 65.
Okay, so you wouldn't get a discount from GoodRx once you're on Medicare C and D. All right, question. Okay, Pam, go ahead, unmute yourself and ask your question.
The question is a bit similar to the one in the chat earlier on in terms of free healthcare. If someone is visiting, say in the UK, the healthcare is free. So if I'm visiting the US and something happens like an emergency, will I be able to get care? Or will I be able to sign some paperwork to say, if I don't have the money up front, to say, well, I can be treated?
Well, with an Advantage plan, like these Medicare plans, if you're traveling out, if you live here and you enroll here and you travel outside the United States, it provides worldwide coverage. So you would have protection anywhere in the world, and the plan would pay for your care outside the United States. That was
Would that be with Humana, or would that be with Medicare or Medicaid?
Well, Medicare does not provide coverage outside the United States, so it would be an
Okay.
Advantage plan. And Medicaid doesn't either, because Medicaid also is by the state. So if you were needing care in the state of Florida, anywhere in the state of Florida, and you had Medicaid, then you would be protected in the state of Florida. But if you go to Georgia or another state, their Medicaid program is different. And so you may not have the coverage that you would expect to have here at home.
Oh, wow.
Mhm.
So it's not a uniform policy.
No, Medicaid is state by state. It's not a federal program.
Okay. Okay. So is there like an advantage, or are there places that offer more benefits than another state, that if you're thinking of moving, that this state would be give you more benefits?
Actually, South Florida has, I mean, for Humana, I can't speak to all the others, but I mean, I've been in Medicare Advantage for 16 years, and I know South Florida is the richest benefits. We get the most money from Medicare because we have the most Medicare eligibles down here. So we get the most money to put into our plans from Medicare, and then the plans are just rich, very rich down here as compared to some other states. I'll travel around the United States to meetings and things. They're like, I can't believe you have 0 for this and 0 for that. You know, we have 50 for that and 60 for that. So if I had to pick any place in the country for the best and lowest benefits, and it would be down here in South Florida, really.
Wow. Wow. Yeah. Okay, we have another question in the chat. So unmute yourself, Sister Anderson, and ask a question.
Yes, good afternoon. I came on late, but I just want to ask this question about, for instance, for Medicare, Medicaid, like people who don't work enough money and, you know, they get the Medicare.
Right.
What about people who makes a little over the salary? Like, for instance, the cutoff point is like, say, $20,000 a year, and you make $21,000, which is still nothing. Just giving an example.
Right.
How could they go about? What's the plan that's in store for people like us who make a little over than getting Medicaid? What insurance you could get?
Well, what I would recommend is if they make a little bit too much to qualify for Medicaid, there is a program called low income subsidy, and that's for people that make too much for Medicaid. There's income limits for those, but low income subsidy is the next level. And what that would do is, and the Social Security office can enroll you in that. And if you get the subsidy, if they allow you to have the subsidy, then the coverage gap, or that donut hole I talked about, goes away. There's no such thing. The donut hole goes away. And then all of the prescription medications are 0 and no more than $7 and $9, depending on the tier. So the low income subsidy is designed for those folks that don't qualify for Medicaid, but aren't, you know, living high on and making a ton of money, where they need some help. And if you qualify for the subsidy, then your medication costs is where you'll see the savings. And you typically don't have to be subject to the donut hole. So you'll get where you'll see the savings is in what you pay out for your medicine.
Excuse me,
I definitely recommend that somebody, you know, apply for that, because it's a wonderful program. I mean, if I was taking a preferred medication, you know, a name brand, and the copay for that is $40, and maybe with the subsidy, I only have to pay $5. So that leaves me a lot more money, right, to spend on other things like food or paying my rent. So definitely, and apply for the and even when people go for Medicaid, there's a box on the Medicaid form that's for low income subsidy. So they should be applying for both on the same form. That way, if they get refused for the Medicaid, they would still be considered for that low income subsidy program.
Excuse me. I don't know if you understand. I'm not talking about like for senior citizens. I'm talking about for people on the senior citizen age.
Okay.
And let me give you an example again. Like for instance, now you make $60,000 and
Right.
over that, which there's no program. You got to go into the full insurance. That's what I'm asking you. Where
Right.
could you find a lower coverage of insurance? I'm not talking for people who
Right,
reach,
okay.
Medicare. I'm talking about regular people like,
Right.
self-employed.
Well, I don't really work in that every day, but I know that with the Obamacare, there's different credits that people get depending on their income and their assets. So if you went on the exchange, you might be able to get some credits, like some money paid towards your insurance that you wouldn't have if you made more money. So I would say sit down with somebody that works more in individual health insurance to see if they can find those credits for you.
Okay,
But
great.
there is some help there.
Great. Thank you. Thank you. Thank you.
Okay, Sister Edwards, could you now continue, sorry, with your other programs that probably you could tell us about, some other insurance for people who are not 65 under the age, that they could get some benefits, because from time to time you get in the mail, this is a dental plan, this is a plan for eyes, this is a plan for this, for people who don't have insurance. So what other plans are there, or even in the marketplace, that they can use as insurance?
There's always Obamacare, and there are some cost sharing, which is, it's not insurance, it's cost sharing, where it's a pooling where they pay for each other's insurance, which is kind of different from the Obamacare.
You're talking the Christian one where you have to be a Christian, because I remember there was something like that I was signing up for once. You mustn't drink, you mustn't take drugs, and is that the one you're talking?
Well, the one I heard about one just this week, somebody was telling me about one that I'm still looking into to see how it works. But apart from that one, I know there's this one that's always on the radio. When you listen to the radio, what is it? I'm not sure what it is called, but it's some cost sharing thing also. Medicare. But Obamacare for right now is the only one that I know, people who sell Obamacare. But when you sell the Obamacare, you have to, it is very important that whoever the agent is, that you have to, there are some questions that you need to ask. Because sometimes when it comes to the end of the year and you are doing your taxes, some people find out that they owe a lot of taxes because they were underpaying Obamacare for insurance. So you'd have to find the agent who does Obamacare. I don't sell Obamacare, and I don't sell health insurance. I weigh only Medicare and life.
Medicare, and life, okay.
And life insurance. So I sell, I market Medicare for Aetna, for Humana, and United Healthcare. But I also do life insurance with whichever carrier you want insurance qualifies for, whether it's a term insurance, whether it is long-term insurance, whether you want living benefits with the insurance, and you need some investment with the insurance. If you want to do a will or a trust, you can call me and I can give you all the information that you need.
All right. Someone is asking, what about Better? Do you know that company Better?
No, I think that's health insurance. No.
Better.
But I look into
Yeah,
it
they're individual health insurance, and from what I've been told is they're one of the better ones. So I've heard that's a good company to have if you are looking at individual health insurance.
Oh, Better. Okay.
Mm-hmm.
All right, I've never heard that before. Okay, Jennifer, unmute yourself and go ahead, and then D. Anderson go. Jennifer and then Anderson. Go ahead, Jennifer.
All right, good afternoon, everyone. So, from experience working in the pharmacy, well, I know Ambetter is also a part of Medicaid too, but you also have share of costs with Medicaid. If you make a certain amount of money and you cannot get the full Medicaid, they give you what's called a share of cost, meaning that you have to reach a certain amount of, like for instance, they said 25,000. So you would have to make sure you go to the doctor or the hospital bill, and then now you can show that to your caseworker. And once they show that to the caseworker, then when you take your prescription to the pharmacy, then they will pay for all of your medication. But you have to, reach the shared costs before they cover anything. So yes, if you don't get full Medicaid, you can get share of costs, but you have a certain amount to reach first before they cover your medication. That's it.
And that is one of the law, what she was saying, when you apply for Medicaid, apply for that at the same time. So if you get denied for one, you can enroll in that one. Is Ambetter one of those low income? Unmute yourself, Jennifer. Is Ambetter one of the low income insurance? Like she was saying that when you apply for Medicaid, apply for both of them just in case you get denied in one.
No, Ambetter is one of the, like you're under Medicaid. They put you in different plans, so you can have Ambetter. You can have different. Like you have I forget some of the names, but that's Ambetter is a Medicaid plan that they put you in to get your prescription when you're approved for Medicaid and to get your
a prescription drug plan, not a health. Prescription drug plan. Okay. All right. Okay, D. Anderson, unmute yourself.
Sorry. Yeah, I didn't really have my hand up, but I'll still ask this question. They keep saying about this Medicaid. I don't know what the government comes up with this Medicaid, or where she's saying the Ambetter plan. You have to be directly poor to get that. Because, I mean, working under $20,000 in New York is nothing. So I don't know why they come up with that plan for insurance. You have to work at least, if you're a single person, you got to make less than 20,000. There's no way you can live on 20,000 in New York. That's impossible. So I don't know, sometimes I wonder what is that insurance for? Because that doesn't make sense. They need to have a better plan than that for people who are, who don't have insurance, full, insurance. They need to come up with a better plan. Because if you work even $30,000, still cannot even do it in New York. You have one bedroom going to up to $2,000. So how are you going to work $20,000? You're working less than what you're going to pay for rent. Your food, your cost of living is very high. So I just can't figure that out. I just want to know what other plan they have, or which other company. Because if you go with Blue Cross, Blue Shield, all these things, they're charging you a bag of money. Plus, you have to come up with these big deductibles and all of that. So I don't know. So I don't know. Nobody can help.
They need fixed. They need to get free, like somebody came on and said,
like in Canada,
free in the UK and Canada.
Exactly.
Okay, somebody on Facebook is saying Ambetter is a HMO. That Ambetter is a HMO. So she was giving the difference between HMO and PPO. That's health maintenance organization, and PPO is preferred prescription.
Preferred provider organization.
Okay, preferred provider, right. So Ambetter is a HMO where you have to go within the network of the doctors that they would put for you. And you're saying you have to work less than $20,000, and in New York, $20,000 is the food bill for the year.
If you depends what you buy, trust me. Very expensive.
Okay.
Okay, sounds good.
All right, go ahead, Sister Donna. Somebody's saying to go to Canada because you get it for free medical in Canada. All right, Sister Donna, over to you, what you were saying. And UK. All right.
Canada, and well, for right now, all we have that is the bare minimum is like the Obamacare.
Obamacare.
That's what I know of for now that could work for those who don't have insurance, health insurance. I mean, it's always good to hook up with Walmart. They have good benefits. Could just get a job with
Yes,
Walmart
that's true.
and get some insurance going, but just don't stay and bounce about. Send down some roots, because this insurance thing, health insurance, is real. When the bills come, it's real. So I would just encourage everybody online, when we are young or whatever age, just try to get a job with a stable company. Well, most of the companies now seem to be unstable, but Walmart, and there are a lot of good companies out there that you can get good insurance with, which is, and I mean, if you are self-employed, you'll have to get either your spouse or somebody's insurance that you can go on your spouse insurance, health insurance. But we want to encourage people, just get a company that you can have some insurance with. And when we come for the next session, we'll be talking about life insurance and how you can make your money grow for you.
Okay, one last question from Pam. We're over the time, but Pam, go ahead. Oh, let me give you the sign. Ask her a question and they're going to come back. Okay, go ahead with your question and give us more information on life insurance. Go ahead, Pam.
Yes, Dr. Monica. And my husband just said to me earlier, and I don't think the question was answered, because my question was really, if I travel from the UK to the US,
United States.
Yes, and something happens, will I be able to get
by the hospitals here?
No, will I be able to get care right away?
You will get care, but if
you probably have to pay for it.
If you're not covered in the US, you'll have to pay out of pocket.
Okay.
unless your policy in the UK cover you for international travel.
Okay, so I'll have to buy probably some insurance, travel insurance.
Or probably when you're leaving, you would buy travel insurance just before to cover yourself for when you're here. But the hospitals in the United States cannot turn away anyone from care, because each hospital have a specific amount that they set aside for those emergency. Because if they reject you for care, you can sue them. Especially if you are hurt, you can turn, and a lawsuit is millions of dollars. And there are a whole set of lawyers lining up to take your case. So they cannot reject you and say, we're not going to see you, but they're going to send you a bill if you don't have the travel insurance cover you outside of the United States.
Of the UK. Thank you very much. Thank you. Thanks.
All right, D. Anderson, did you still put up here? Okay. Last comment from Sister Anderson.
Last comment. Okay, I don't know if it's still going on, but the only good thing I can tell her about New York, coming to New York, don't have an insurance, you get sick. I don't know if it's going on today, but up to last month, I heard of it. You stand a better chance, because if you come, you go to the hospital, they take care of you. They ask you for insurance first, when you go to the emergency room, but they take care of you, do surgery, everything, and people leave and they don't even have to pay for it. And some people automatically get, they call it emergency Medicaid. Emergency Medicaid. So that's the good thing about New York. You get all those things. So people, because I remember a couple of years ago, my aunt came up from Jamaica and she got sick and we bring her to the emergency. It was like 10 years ago. And she had every procedure done, everything done, and she got emergency Medicaid for that service. So I know I don't know if they're doing it up to today, but I know up to last month, people get it done. So that's the only good thing. But for you to live here and don't have no insurance, you don't get that lucky likes like that. Okay, because they got to see your salary. You got to check your salary. You cannot lie, because once they put your social security, everything's going to come up.
Everything going to come up. Okay, okay, Donna Scobie, could you answer that? Does Florida have that as well, right? Emergency Medicaid for foreigners or visitors?
I really am not sure. I'm not sure.
Okay.
I would have to check. I don't want to say yes or no and be wrong. So
someone says they do in Florida. Someone is answering that yes, Florida have emergency Medicaid. All right. So see, Sister Anderson, We have that too here in Florida. So if they get sick in Florida, I know the hospitals, someone got it for their son. Okay, so it's also here in Florida. But I know for people that came up and get sick, because I've taken somebody to the hospital and they got care. Of course, they send them the bill and they did not pay the bill. They got the care and they went to the hospital and they were not turned away for the fact that they were a visitor. That I know, because they will be sued if you do that. All right. So thank you all so much. Sister Donna, they'll be back next week talking about life insurance and the different kind of life insurance. It's in every state. Okay, somebody says that the emergency Medicaid is in every state. Write it in the chat for me at okay. Somebody can put the what do you want to be written in the chat? Her information or her contact number to be put in the chat. Anybody can contact me, whether on the Monica Jones Ministries chat, and I could pass on Sister Edwards' number to you if you need to speak to her. And then we're going to have someone next week from Jamaica to talk about, but Humana does not offer personal insurance here in the United States, but we're going to get some from Jamaica to see. I know Blue Cross Blue Shield is there. I know they have the HMO and the PPO. I know they have Alico and the others. So, and Sigma and Aetna. So we're going to get, when Sister Donna has finished her presentation, but next week we're going to be talking about what can you get in Jamaica to what's the insurance there and what is the health insurance and the life insurance outside. So I want to thank Donna Scobie. We had the two Donnas today, Donna Scobie and Donna Edwards, and this was very interesting and informative. And if you need to contact either one of them, you can contact me and I'll be more than happy to pass on the number to you. And I learned something about emergency Medicaid. I did not know that before. So I hope that you're learning with these sessions that we're having. God bless you. Remember, see you at 6 p.m. We are back on the prayer line and pray. And as Sister Jennifer will tell you, that's my insurance plan and that's my medication and that's my prescription. Prayer. Amen. God bless you. See you at 6 o'clock, everyone.
And the blood.
Your day. And the blood of Jesus, right? And the blood of Jesus. Drink and pray. Amen. God bless you all. And see you at 6 p.m. And next week, they'll be back and we learn more about life insurance. Amen. And remember, life insurance, now they have a health benefit to you, a wellness benefit. That was always my problem with health insurance because I was never sick. And every year they pay this amount of money for me and I'm never sick. And the sick people go and I just go every 6 months. And I'm saying I should be getting the money for not going to the doctor because I was never sick. All right. Somebody came on very late. Please contact me on the WhatsApp chat and I'll pass on Sister Edwards' number to you and she will tell you how you can apply to get those benefits. Amen. God bless you and see you at 6 p.m. We're signing off now and see you on Monday, Tuesday, and Thursday for the next